The list of speakers can be viewed online by visiting the Board of Health page at toronto.ca/council and clicking the speakers box for today's meeting. The Board Secretary has provided all agenda materials on toronto.ca/council and via CMP, the clerk's meeting portal. Directors, please keep your mic muted unless you wish to question staff or speak to an item, and ensure that your video is turned on. As part of each agenda item, I will ask directors to raise their hand or unmute their mic if they wish to question staff or to speak. I will then create a speakers list and will call on directors when it is their turn to speak. When voting on an item or motion, I ask directors to ensure that they turn on their video and to raise their hand to indicate their vote. Directors, I want to remind you that you must submit and approve your motions by email. Staff are available at boh@toronto.ca to help with motions. The Board of Health acknowledges that the land we are on is the traditional territories of many nations, including the Mississaugas of the Credit, the Anishinaabeg, the Chippewa, the Haudenosaunee, and the Wendat peoples, and is now home to many diverse First Nations, Inuit, and Métis peoples. We also acknowledge that Toronto is covered by Treaty 13 with the Mississaugas of the Credit. The City of Toronto acknowledges all treaty peoples, including those who came here as settlers, as migrants, either in this generation or in generations past, and those of us who came here involuntarily, particularly those brought to these lands as a result of the transatlantic slave trade and slavery. We pay tribute to those ancestors of African origin and descent. Are there any declarations of interest under the Municipal Conflict of Interest Act? If you have an interest, please raise your hand or unmute your mic and indicate the item number and the nature of the interest. And seeing none. We've convened this special board meeting to attend to a few urgent matters ahead of the holiday recess. As Dr. Villa is retiring at the end of this year, we must move forward with the appointment of an acting medical officer of health. Also, timely is the continuation of our response to provincial changes to regulation of safe consumption sites. On November 18th, the provincial government officially tabled the Safe Streets Strong Communities Act, which includes legislation that will prohibit safe consumption sites from operating within 200 meters of a school or childcare center. They chose to fast-track the bill, foregoing opportunities for public hearings, and on December 4th, it was officially passed. Today, I have brought forward a motion recommending that our Medical Officer of Health and I, as Chair of the Board of Health, respond to the legislation through a letter to the Ministry of Health in the absence of formal public feedback process. I understand that the passing of the Safe Streets Stronger Communities Act will have a detrimental impact on many people across the city, and I am committed to speaking in alignment with the body of research that shows that safe consumption sites save lives and are a crucial component of substance use response. So now, before we start the agenda, we have a new business item to add, which is appointing of an acting medical officer of health. Abby, you want to move this item? All those in favor? Opposed? Carried. Thank you. I also want to reorder the agenda in that item 3, one moment, which will be the appointing of the acting medical officer of health, will be now item number 2. Yes, that's what we're going to do. Okay. Do I need a motion for that, Gina?
No, but as long as there's general consensus.
Okay, and everyone's okay with that? Okay, wonderful. Okay, I think we're going to close session now for item 1, or we just need to refer that.
We do have speakers on item 1, so if you wanted to.
Okay, that's correct. So we do have 3 speakers on this item, but I do want to say to the deputants so that we are referring this item to the HR committee. So if you do still want to speak to it, you can do that now, or you can do that at a later date when the item returns back to the Board of Health. And the 3 speakers of this item are Mariko Ude. Are you here? Teresa Dinnen, are you here?
I'm here, Mariko Uda, I'm here.
Okay, did you want to speak to this item today, or do you want to speak to it when it comes back to the board at a later date?
If I can do it today, that would be great because I prepared.
Okay. You can. Okay, go ahead. 5 minutes.
Okay. Good morning. Given that the board members rely heavily on the medical officer of health for scientific and policy advice, selecting the next medical officer of health is a very important task that will largely impact the health of citizens of Toronto going forward. And since I'm not able to choose the medical officer of health, I would like to take this time today to just quickly share 2 criteria I have. Number 1, my hope is for a medical officer that will be open to listening to what I and others have been sharing over the course of the COVID-19 pandemic. Dissident voices, in particular, the growing number of scientists around the world who are speaking up against the COVID-19 vaccines, for example, are critical to listen to. In Canada, we have the Canadian COVID Care Alliance and the National Citizens Inquiry. Number 2, my hope is for a medical officer of health that will independently assess the appropriateness of directives from the WHO, federal agencies, and the provincial Ministry of Health. These authorities can make mistakes sometimes and can be politically motivated sometimes or have ties to big pharma. We need a medical officer of health who will take information from these authorities and critically assess if it's good for the health of Torontonians. I acknowledge that the science can be confusing because there's some scientists that say this and others that say that. And I also acknowledge that to do a critical, thorough assessment and making the right decision 100% of the time may not be possible. However, if not sure, the medical officer of health could implement a best option A based on their judgment at the time, but then carefully check if A actually works by listening to citizens and examining local data and pausing and readjusting if called for. Action at the local level is so important, and your jobs are so important. Increasingly, in different parts of the world, local councils are pushing back against the COVID mRNA vaccines, for example. I'll share 2 examples. One is in Australia, a local council, the local council of Port Hedland passed a motion in October calling for a halt to the mRNA vaccines due to DNA contamination and its potential health risks to cancer and immune system disruption. And in Idaho, in October as well, the Southwest District Health Board voted to halt vaccine distribution, COVID vaccine distribution in its health clinics following weeks of public commentary and presentations by health experts at the local council. Similarly, Toronto Board of Health and the next medical officer of health do not have to blindly follow orders from higher jurisdictions. Toronto Board of Health and the next medical officer of health have the power and the moral obligation to protect the constituents of Toronto. Sometimes this will mean following the federal and provincial government recommendations. Other times, however, this will mean saying no. And it would be great if the next medical officer of health has the skills and is given the time and mandate to do this. Thank you so much for your time today. I hope you have a good holidays, and thank you for allowing me to share my thoughts.
Yeah, thank you. The next person that's on the list is Teresa Dinnen. Are you here? Oh, Daniel Freiheit?
This is Therese. I'm here, but I think I'll wait until the next meeting when this is brought up in the agenda again.
Okay, thank you. Wonderful.
Thanks.
Daniel Freiheit. Okay.
Because the item is not used there.
How about that?
And, as I mentioned, this item is coming back at a later date. You can choose to speak now or at a later date.
Yeah, thank you. I'll come back. Thank you very much.
Okay, thank you. Okay, so we are going to refer this to the HR committee. Do any of the members want to speak to this item or ask questions of this item? If you do, we may have to go into closed session. Councillor Thompson, go ahead.
I think we probably should go into closed session, Mr. Chair.
Okay. Do you have a motion to?
Do you want to go into close on this alone, or do you want to go?
So one moment, the clerk is just working on something.
Sure.
So what we're going to do is item 1 and 2, which is the acting medical officer of health. We're going to do in closed session together. That way we could deal with it, come back out in public and deal with item 3. Okay, procedurally, I was just told that because we want to have item 1 and 3 in closed session, so I have to hold item 1 down, which I will do now. And so item 3, anybody wants, well, this is also a closed session item. You want to speak to this, Gina? You're the clerk, so just procedurally.
It's more, it was just if there's any members that do have any, public questions, they can be asked in public first, and then we
Okay.
can go into closed.
We can also do public questions after, right?
Yes, we can do public questions after. That's correct, according to the clerk. Okay, so we'll hold item 1 down. Item 3, we will speak to any public questions on item 3. Seeing none, so we'll actually go into closed session. So we have a motion to go into closed session.
Yes, we do.
Okay, great. Do I need to read that? Oh, glasses. That the Board of Health recess its public session to meet in closed session to consider HL 19.1 appointment of medical officer of health as relates to a personnel matter pertaining to the appointment of a medical officer of health, and item HL 19.3 appointment of acting medical officer of health as it relates to personal matters pertaining to the appointment of an acting medical officer of health. So the clerk will.
Are you making the motion?
Yeah, I move the motion. All those in favor? Opposed, carried. Thank you. So now, so councilors and directors stand by. We just moving people out of the into the
Mr. Chair,
public room. Go ahead.
it's Dr. Davila here, just asking, how will clerks notify us when you need us back?
We can send an email, right? How's it normally done, Gina?
We'll be moving into, well, they're in the lobby. If you're moved into the lobby, you'll be moved back in once the closed session is over.
Okay, perfect. Thank you.
Just bear with us. We're still getting live stream up and running. Okay, recording is resumed. Live stream is up and running again. Thank you very much.
Okay, well, thank you to the public for rejoining us. We're out of closed session now and back in public sessions. So we're going to vote on item number 1, which is appointment of medical officer of health. There's a motion that's going to be put on screen to refer this back to the HR committee. Okay, there we go. All those in favor? Opposed? Carried. And now item number 3, which is appointing of the acting medical officer of health. We're going to adopt the recommendation on this item. All those in favor? Opposed? Carried. Okay, and now we will go to item number 2, HL 19.2, responding to the Safer Streets, Stronger Communities Act. Words. Thank you. We do have several speakers of the item. First up is Brett Wilson Stufko, Toronto Harm Reduction Alliance. Are you here?
Hello.
You have 5 minutes. Go ahead.
Good morning. Thank you for the opportunity to speak. My name is Dr. Brett Wilson Stofko. I'm a parent and a scientist and the co-chair of the Toronto Harm Reduction Alliance. And I've worked in harm reduction for nearly 17 years in Toronto and New York City. I've worked at syringe exchanges, supervised consumption sites, homeless shelters, and conducted research on HIV, hepatitis C, and the development of overdose prevention strategies. My opinions today are my own and not necessarily those of my employer or funders. I have family who have struggled with addiction, some for over a decade. I found one of them the first time they overdosed on heroin early in the epidemic before naloxone was widely available. It was traumatizing and terrifying having to give rescue breaths to a teenager with blue lips and a weak pulse. Luckily, EMS arrived quickly and revived them with naloxone. Sadly, many friends, colleagues, and clients have not been as fortunate, and I'm here on behalf of them and their families to make it known about how devastating the province's so-called Community Care and Recovery Act will be on the people of Toronto and the restrictions on supervised consumption sites that it entails. Rates of drug use and addiction in Canada have not increased for over a decade. The rate has remained constant. It is in fact the unpredictable illicit drug supply driving the overdose death rate, not more people using drugs. This is why supervised consumption sites are so crucial. The drug supply is toxic, so we need to accept people for who they are and provide them with the supports needed to help them stay alive and healthy until they find their way. Decades of evidence clearly demonstrate the effectiveness of supervised consumption sites. Both internal ministry reports and taxpayer-funded external reports all recognize their public health and public safety benefits. Neighborhoods with supervised consumption sites in Toronto experienced a 2/3 reduction in overdose deaths, a 50% reduction in public injection by unstably housed people, and a significant decrease in homicides, assaults, and robberies. Additionally, both external reports recommended greater investment in supervised consumption sites, not to close them. Closing supervised consumption sites will drastically increase the overdose death rate, increase public injection, increase the number of discarded syringes in our communities, overwhelm both EMS and hospitals, and may needlessly create mass casualty incidences. Supervised consumption sites in Toronto right now respond to approximately 2,700 overdoses per year. If we conservatively estimate that 10% of these overdoses would be fatal had they occurred in the streets, Toronto's overdose death rate would increase by 50%. We would go from 525 deaths a year to 795. This again is a conservative estimate. I fear it might be higher. The Auditor General report released this summer on Toronto paramedic services found that there were 1,200 times an ambulance was not available for someone in need in 2023. That means people in car accidents, people having heart attacks, children having severe allergic reactions already cannot get the life-saving emergency care they need, and this problem is only going to be exacerbated once supervised consumption sites are closed. Instead of an overdoses being addressed indoors at supervised consumption sites, paramedics will be responding to overdoses in alleyways, business washrooms, and on people's front porches, creating even further strain on paramedic services. There's also no evidence suggesting that heart hubs will be effective at preventing overdose deaths. Their alleged role is to refer people to detox, drug treatment, and housing, all of which are not available because the province has refused to invest in them. Besides, supervised consumption sites, homeless shelters, and community health centers are already making all of these referrals. The key difference is that these heart hubs will be forbidden to provide any harm reduction supports while people wait months or even years for these essential services. This is going to increase HIV and Hep C as well as overdose deaths and the strains on emergency services. In closing, I'd request that the chair, the Board of Health, and the medical officer of health engage the city's solicitor about legal responses to challenge relevant parts of the Community Care and Recovery Act in regards to restrictions on supervised consumption sites and report back to the Board of Health by December 18th. Additionally, I request that the chair and the Board of Health immediately advise Mayor Chow and the rest of the City Council about the health implications of this Community Care and Recovery Act for Toronto and to Toronto Public Health. Lastly, I ask the Board of Health I asked the Board of Health to instruct their chair to put a motion before City Council at the next City Council meeting to legally challenge the Community Care and Recovery Act, which encroaches on the jurisdiction of the city to protect the health and safety of its residents. Mourn the dead and fight like hell for the living. Thank you for your time.
Thank you. Any questions for the deputy? Seeing none. Thank you. Next up is Nick Carverhill. Carverhill, are you here? Nick Carverhill. Callum Houston, are you here?
Nick is here.
Nick is here?
Yes. Hello?
Okay, go ahead, 5 minutes. 5 minutes, go ahead.
Thanks for having me, Board of Health. My name is Nick Carverhill, and I'm appearing before you first and foremost as a community member who cares for and cherishes the people in my life, my neighborhood, and my city who happen to use drugs. I'm one of those people, although I am shielded by class and racial privilege from being criminalized and marginalized in the ways that many others are. Professionally, I've worked in 3 of the city's supervised consumption sites as a health promoter and overdose response worker, as well as in community-based public health research. I also lead substance use and addictions policy for the Ontario division of the Canadian Mental Health Association. While my views are informed by these experiences, I speak on my own behalf today. December is an especially difficult month for the many of us who have lost loved ones, friends, and beloveds to the toxic drug poisoning crisis. They are dearly missed with particular intensity as the holidays approach. Thus, as I often do in my own home, I want to name and invite a small number of our ancestors to join us in this space as we plead for this board to take action on the motion before us. Noah, Angie, James, Alexis, Mark, Michelle, Dan, Jeff. They were and are parents, siblings, friends, aunts, uncles, children, lovers, and intrinsically and unconditionally worthy of love, dignity, and belonging. At this point, you must all be well aware that supervised consumption sites are one of the strongest evidence-based interventions that we have to connect people who use drugs with care and wraparound services, prevent drug poisoning deaths, reduce the spread of transmissible disease, and decrease the likelihood of public drug use and overdose. The provincial government's own expert findings demonstrate that closing SCS will very likely lead to an increase in pressure on our emergency departments and paramedic services, lead to increase in public drug use and improperly discarded drug gear, and deaths due to overdose. It is also very likely, based on data from various jurisdictions across the province, that supervised consumption sites help improve community safety. Indeed, in Toronto, data shows decreases in rates of homicide, assault, and robbery in the vicinity of SCSs after opening. In order to escape the terrors of our decades-long toxic drug crisis, we need the full spectrum of services from harm reduction to treatment and recovery, not just one or the other. This past Thursday, the UN Human Rights Chief reiterated that, quote, the war on drugs has failed completely and utterly, and in the process has, quote, destroyed countless lives and damaged entire communities. This policy would be a continuation of that shameful legacy, and just as with other aspects of this failed approach to substance use, the effects of the closure of supervised consumption sites will most disproportionately affect low-income, Black, Indigenous, and gender-diverse clients. The clients who I've spoken to about the closure of these sites are in turn terrified and exasperated. Although abandonment to death is a familiar feeling for Toronto's community of people who use drugs, I urge you to reject the inevitability of this provincial legislation and the structural violence it will inflict on our most vulnerable community members. We all stand to suffer if supervised consumption sites close in our city. The choice before us is either to save our sites or to fill our morgues, ambulances, and emergency rooms. As such, I also urge the Board of Health to instruct the board chair and the medical officer of health to engage the city solicitor about legal responses to challenge the Community Care and Recovery Act and report back to the board by December 18th. Second, to instruct the medical officer of health to immediately advise City Council, including the mayor, about the health implications of the Community Care and Recovery Act for Toronto and Toronto Public Health. And third and finally, to instruct the board chair to put a motion before City Council at the next council meeting to legally challenge the Community Care and Recovery Act, which encroaches on the jurisdiction of the city and its ability to protect the health, safety, and well-being of all of its residents. Thank you for your time and attention.
Thank you. Any questions for the deputant? Seeing none. Thank you for coming in today. Callum Houston, are you here? Callum Houston. Okay, Patrick Murray.
This is the host. Callum is here. He's just unmuting himself.
Okay, go ahead. 5 minutes.
Hi, my name is Callum Houston. Thank you for having me. I'm a community activist around harm reduction, and I'm just here to reiterate what has already been talked about by by the previous speakers. The Ontario government has decided to introduce Bill 223, knowing that even from their own experts, there is a high risk it will increase emergency department visits, overdose deaths, and other negative health impacts, as well as public use, and disproportionately harm Indigenous, Black, and low-income people in Ontario. Ample studies, including internal government reports and independent evaluations, consistently demonstrate a range of public health and public safety benefits of SCSs. According to a recent report on SCS in Ontario, Ontario's supervised consumption services have recorded 1.12 million visits from 178,000 unique clients since March 2020, and have facilitated more than 530,000 service referrals, including housing, case management, and substance use treatment, and they've successfully reversed 22,000 overdoses. SCSs also reduce public drug use and discarded drug use equipment. Contrary to the Ontario government's belief, that crime has increased in neighborhoods with SCSs relative to other neighborhoods. Data shows decreases in rates of homicide, assault, and robbery in the vicinity of an SCS after opening. Moreover, a recent report from the Office of the Auditor General of Ontario found that the decision to close SCSs was made without proper planning, impact analysis, or public consultations, and is not based on any evidence. According to media reporting, the Ontario government has been warned by their own lawyers that municipalities may be critical of the province limiting their autonomy in addressing the opioid crisis, and that the prohibition of SCSs within 200 meters of a school or childcare center creates a high risk of infringing on the charter. Specifically, the advice laid out that Section 7 of the charter, life, liberty, security of the person of site users, could be contravened. In order to win a charter challenge, they indicated that the government would have to demonstrate that the operation of an SCS is always unsafe or harmful, even when operated under reasonable conditions, which is not supported by evidence. Again, given the unpredictable disproportionate impact on people who use drugs, especially Indigenous, Black, and low-income people, it could also be argued that the bill violates Section 15 of the Charter that protects individuals against discrimination. In light of this, we urge the Board of Health to instruct the board chair and the medical officer of health to engage the city solicitor about legal responses to challenge the Community Care and Recovery Act and report back to the board by December 18th. Instruct the medical officer of health to immediately advise city council, including the mayor, about the public health implications of the Community Care and Recovery Act for Toronto and Toronto Public Health. And finally, instruct the board chair to put a motion before city council at the next council meeting to legally challenge the Community Care and Recovery Act, because it encroaches on the jurisdiction of the city to protect the health and safety of its residents. I urge you all to make the right decision, the moral decision. Thank you.
Thank you. Any questions for the deputant? Seeing none. Thank you. Patrick Murray here. Patrick Murray.
Hello, everyone. Can you hear me?
Yes, 5 minutes. Go ahead.
Great. Hi, everyone. My name is Patrick Murray. I am an overdose prevention support worker, and I am also a recovering crystal meth addict. I usually save that last piece of my intro for meetings that are a bit more anonymous, but it seems relevant to the discussion today. Especially because I am here to personally attest that despite the provincial government's misinformation, harm reduction and abstinence do not exist in opposition. Harm reduction was my foot in the door to recovery, and I don't know if I would be here speaking with you today if it wasn't there, which is why I'm asking the Board of Health to legally challenge the Community Care and Recovery Act. When I was 23 years old, I accessed harm reduction services for the first time without knowing it. I was new to intravenous drug use, and I remember messaging someone saying, like, where do you buy needles? I didn't know what size they were supposed to be. I didn't know anything. And I was told to go to Casey House where I could get them for free, so I did. The second time I injected, I missed my vein, which I didn't know either. I just knew that it burned and it hurt and I was scared. I thought I was dying and I thought that I was going to lose my arm. I had no idea. I went to an emergency room and the nurse triaging me there was kind and she said I was going to be okay. And that's really what I remember from that night. I remember being scared. I remember being alone. I remember someone being kind. My first foray into recovery was through the CAMH Rainbow program, which is also a harm reduction model where we could identify substances of concern, what goals we had. I knew I wasn't interested in that at that time in any program that involved quitting drinking or smoking marijuana. So CAMH offered me a safe place to discuss the things I had been too scared to tell anyone about. This is usually the part of my story where I skip ahead to when I went to treatment and got sober and stayed sober, which I did. But that was 2 years later. And it's hard to explain or remember 2 years when it's kind of like having the worst day ever, but it's 2 years. when I finally was ready to ask for help again, my parents signed a check. I was able to choose the day I went to treatment, and that was $30,000. I'm not ashamed of my previous struggle with crystal meth. It has actually made me uniquely capable to work in harm reduction. In recovery, we often say the opposite of addiction isn't sobriety. The opposite of addiction is connection. And the connections I've made working in harm reduction have been invaluable to my recovery and the recovery of my friends and neighbors who use drugs. Harm reduction to me is so much more than preventing overdoses and saving lives. Often I can't really wrap my head around the fact that part of my job is saving people's lives. I think because then that means conceptualizing the fact that those lives could be lost and those lives are people I care about. Ooh, okay. Well, I'm gonna try to get through a note someone wrote me. Good luck on that. Okay, so this is a note I have on my fridge that a client wrote me, which is just that there was and have been days I just want to break down and cry and give in. But I walk through the doors of the safe injection and seeing you there and just having a 2-minute talk with you put all my hurts, tears, and doubts aside. I've been so lost, losing my husband to jail, the only other person who gives me life. And no matter what decision is made or where we end up going, you will always have a space in my heart. And one last thing, don't stop helping people who need the help. So I'm asking you to do everything you can to let us keep helping people. Thank you.
Thank you, Patrick. That was heartfelt. Any questions for the deputant? Seeing none, thank you for sharing. Much appreciated. Dane Kent, are you here?
Yes, I am here.
Go ahead, you have 5 minutes.
Sorry, I apologize for the ad hoc nature of my deputation today. The child we expected tomorrow arrived yesterday, so I'm in St. Mike's Hospital.
Then congratulations.
Thank you very much. I wanted to take a few moments today to talk to the councillors on the board, our elected representatives, and explore the underlying reasons why people get into politics in the first place. And I believe that people get into politics out of a sense of conviction for good, and the desire to leave a lasting impact and legacy on the communities that elect them. And I feel the council today has arrived at a point at which the decisions they make will affect the trajectory of that legacy going forward. You're going to hear a lot from a lot of different people today regarding the implications of the closure and the nuts and bolts of all of this sort of stuff. But what I really want to talk about is the impact that this council can have on the city going forward, and how this council and the representatives on it will be remembered in the future as we look back. I think people enter into politics because they want to be a force for good. And I think in a political life, if you are acting as a representative in a moment when there is a big difficult decision to make, when the odds are stacked against you, and when you and your sense of conviction proceed forward in a manner that identifies a positive outcome in the face of perhaps misinformed opposition, I think it's imperative for this council to take the steps necessary to enshrine and make sure that we're preventing the closures of these CTS sites. You know, the decision you make today, if you decide to continue and to find the money to fund the sites in the city that have exemptions that haven't expired yet. Some have exemptions that aren't expiring for another 2 years. If those sites could be funded in the face of an injunction, for sure you're going to have some people call your office and say, "I can't believe you've done this." And you're going to have people call your office and say, I'm so thankful that you've done this. But if you choose to do nothing and you choose to allow these sites to close, in 6, 8 months, 12 months from now, you'll still be getting phone calls, but those phone calls will be people complaining about the proliferation of discarded paraphernalia in their parks and laneways and schoolyards. Those calls will be about people feeling a sense of loss at family members who didn't have an ambulance arrive in time. People are going to be calling about the overcrowding in emergency room departments. There's an opportunity here to have at least some impact, some positive outcome on the systems in our city, on the sense of support that our most marginalized citizens feel from their elected representatives, and fundamentally to be looked back upon as a council that stood up to a government that was making decisions based on ideology as opposed to evidence, and a council that can be remembered as having a lasting impact and a positive effect on swaths of this community in this city, in a way that will be remembered as a council with courage. And I encourage you to explore what your legacy might look like and how you may be remembered. Thank you, that's all.
Thank you, Dane. Any questions for the representative? Saying none, thank you. Megan White, you here? Megan White. 5 minutes, go ahead.
Hello. Firstly, I would like to acknowledge those who we've lost due to the toxic drug supply. Caitlin, Philip, Emily, Greg, Eddie, Michelle, Mark, Vanessa, Danielle, Kyle, Joe, Alex, Sarah, to name a few. All of us know CTSs are not a fix to the opioid epidemic, rather an essential healthcare service for those impacted by it. A service in desperate need of expansion, so the evidence says, but we've come to live in a world that prioritizes harmful rhetoric and stigma over saving human lives. I could go over the statistics and evidence that were so blatantly overlooked and ignored by the Premier and Minister of Health, but I want to humanize the numbers we have all been made so familiar with. I wanted to speak here today on behalf of those who will be most impacted by Bill 223. I've had the privilege of being a frontline worker at one of Toronto's CTSs that are slated for closure for about 3.5 years. Working in the site, I've met individuals who bring such an irreplaceable uniqueness to the world. On August 20th, these same people were handed a death sentence by the very system meant to implement services based off the evidence and statistics provided to them to show what is needed throughout our communities. 8 people in our city are likely to die today. Right now, they're functioning as we are, conversing, sharing stories, engaging with their community, attempting to have their basic needs met. They'll likely pass people who will give them looks of dismay as if their obvious disapproval raises a pedestal and grants them some sort of tangible hierarchy. This will happen more than once, and hopefully before their final moments come, they'll have the opportunity to come into a CTS like the one that I work in, where they will be met with smiles, snacks, and empathy. We'll learn their name and listen to whatever they're willing to share. They'll have a moment of solitude and comfort before the hours of our essential life-saving service has to close its doors. And that is when an entire community is left without a lifeline. At the very least, in the city of Toronto, folks are left for 10 hours without an open CTS. That is 10 hours a community will have to have the daunting task of keeping each other alive, responding to their friends as they lie lifeless. Some will use alone, and out of those few, some will make it until we open our doors, and some will be a part of the 8 we lose a day in the city of Toronto. As of April 1st, 10 hours will become 24/7. The number of deaths will skyrocket. The immense amount of grief felt amongst the community is going to continue to become unbearable. The trust that was developed between staff and clients of the CTSs will not be recreated within these heart hubs. The trust that was developed led to many folks getting connected with primary care, housing, services, case management, and many other services that have had positive impacts on people's health and health outcomes. We focused heavily on the children in these scenarios, but I beg to question why there are so many children being left out of the conversation. I consider myself one of these children, 27 years old, but still the child of someone who uses drugs. So why does the fear of one person's child seeing the pain of another outweigh my fear of being contacted about my father's death? When does community start to include all of us? I would implore the medical officer of health to immediately advise City Council, including the Mayor, Olivia Chow, about the negative implications this bill will have on Toronto and Toronto public health. Collectively, as both professional and those living with experience, stress the importance that the board put forth a request for the chair to put a motion before City Council at the next council meeting to legally challenge community care, to immediately challenge the Community Care and Recovery Act, which encroaches on the jurisdiction of the city and their ability to protect health and the ability to protect the health and safety of those of whom reside within its borders. Thank you.
Thank you very much, Megan. Any questions for the applicant? Seeing none. Marina Klassen. Marina Klassen.
Hey folks, can you hear me?
Yes, we can. Go ahead. You have 5 minutes.
All right. Good morning, Board of Health. Thank you for the opportunity to speak with you this morning. My name is Marina Klassen. I'm a frontline harm reduction social worker. I've worked in this field for the past 10 years, and I'm here to speak to you about the need to protect and keep operational life-saving harm reduction services in our city, and the need for the board to challenge the province for the health rights and safety of Toronto citizens. So for the majority of my career, I've been living under the shadow of the toxic drug crisis. It's been like living through a war, but a war that many don't seem to acknowledge. I have lost countless clients, colleagues, friends, and community. For many of us, we came into this work because our clients could have been us. When I'm advocating today for them, I'm also speaking up for my younger self and for all the people that I couldn't be here with me today. So the other day I made the mistake of counting the number of people I personally have lost. It's 24. So I'm 31 years old and I've lost 24 precious people to me. No one should have to bear the weight of that grief and trauma. But the sad thing is I'm one of so many that carry those experiences now. Overdose doesn't discriminate. It impacts communities in every demographic of our city. I don't need to tell you that it's become the leading cause of death in Ontario for folks under 65, and we know that Black and Indigenous folks are disproportionately represented in those deaths. One person dies every 2.5 hours, even with existing overdose prevention services at this time. So that means that in the course of this meeting this morning, we have lost one more beautiful human life. These are friends, children, siblings, parents, and loved ones. And this is not acceptable. I know you know it's not acceptable. Rather than scaling up our responses, we are now faced with a provincial government that is destroying what little defenses we have left to stop the deaths. So we need your leadership as the Board of Health to legally challenge the Community Care and Recovery Act to protect the health and safety of Torontonians. In Toronto's SESs alone, nearly 11,000 overdoses were reversed just between 2020 and 2024. Ford's decision to shut down SESs, safer supply, needle exchange services means Toronto communities have less tools available to support themselves and we will be at a net loss for all the health strain that is going to come onto our healthcare system following the closures of the SESs. We have an Ontario Healthcare Act and a Charter of Rights and Freedoms for a reason, so that our healthcare doesn't become a political tool to be played with at the expense of the well-being and lives of others. So Ford's actions to close SESs flies in the face of our protected rights and health. I think that your responsibility as the Board of Health is to ensure that the public health programs and services are delivered to the city in response to local needs. Your role is to reduce inequalities in accessibility of care and to improve the health of the city's population. I know you care and have compassion for us. I've seen it, but I need to see action that goes along with those words. We need your leadership and your voices now more than ever. We need you to stand up in Ford's government, against Ford's government, and advocate for the most vulnerable in our communities. And if necessary, we need you to find the funding for the operating budgets to keep safe consumption services and harm reduction services open at the 5 Toronto sites slated for closure. I know that there is money that goes into budgets like police and other spaces that I think could be funneled back into safe consumption sites. So like my colleagues before me, we have very specific asks of you today. We ask that the Board of Health instruct the board chair to engage the medical health officer to engage the city solicitor about legal responses to challenge the relevant parts of Bill 223 and report back to the board on December 18th. We instruct the medical health officer to immediately advise City Council, including the mayor, about the health implications of the bill for Toronto and Toronto Public Health. We ask that the board instruct their chair to put a motion before City Council at the next council meeting to legally challenge the Community Care and Recovery Act, which encroaches on the jurisdiction of the city to protect the health and safety of its residents. We will honor the dead and fight like hell for the living, and I am so grateful to be here to speak for those I have lost. Thank you.
Thank you. Any questions for the deputant? Thank you for coming in today. Juliana Cullen? Juliana?
I don't see them in the attendee list.
Okay. Toby Stevens Gal? Toby Stevens Gal?
I just promoted them.
Okay.
Hi, can you hear me?
Yes, we can. 5 minutes. Go ahead.
Great, thank you. I'd like to thank everyone present for the opportunity to speak on this issue, as it's one that's it's an issue that's very close to my heart. I'm a registered nurse that's worked in these sites for more than 2 years now. Prior to that, I worked in emergency departments in Toronto. I worked in Mount Sinai and St. Mike's. It's unfortunate that explaining the impact of these closures often sounds as if we're overstating the negative effects. And I'm sorry that I'm repeating the things that the people who have come before me are saying, that the people after me that are saying. But there's no way to talk about this without stating it as plainly as possible. These sites save lives, hundreds of lives every year. And when they're closed, many of those people will die. These are people who live in this city. These are your constituents, and these are our neighbors. They're accessing healthcare, and the access to that healthcare is being removed by the province. Without the interventions that we provide at these sites, we will have hundreds of more preventable deaths every year in this city, often on the street. I feel the need to speak to this because as a healthcare provider, I find this unacceptable. The data shows that the staff and the peers working in the SESs across the province and in the city have reversed thousands of overdoses in the few years that we've been operating. It's potentially thousands of lives saved that otherwise wouldn't be. If we were discussing any other healthcare intervention, dealing with any other population, the idea of removing that life-saving intervention would be ridiculous. It would be laughable. And I'm sorry again for repeating myself, but I'm discussing an intervention that has saved thousands of lives in the context of the toxic drug crisis that has killed and continues to kill thousands of people in this province every year. These closures are going to have a disastrous effect on the city. What we do in these sites is save people's lives and provide them with healthcare, provide them with access to social workers, help with housing, counseling, help with jobs. Many of the people who work in these sites are people who use drugs or used to use drugs, who now have decent jobs and are no longer living in the street. Without these sites, that isn't a possibility for many of our clients. Many of the people that come through our doors don't have anywhere else to use but outside on the street and don't have anyone to keep them safe when they use. In the sites I work, We average 2 overdoses that we respond to per day with oxygen, trained staff, and at times in the lock zone. 2 per day in my site. People will not stop using drugs when these sites close. They'll just use in public spaces, unsupervised. 2 overdoses per day in each of my sites that will now be happening on the street. And that is just, again, just my site. We're talking about probably 17 of them, probably every single one of them across the province that's going to be closed in the next couple of years. I've also, as I said, worked in emergency departments in this city, in Mount Sinai and St. Mike's. Both of them deal with a large amount of patients that are coming in after an overdose. They're both obviously swamped, as we keep hearing about. The work in these sites directly offloads work from our emergency departments and our ambulances, which are also swamped every day. I can also say, as somebody that works in those emergency departments, we've saved people's lives from overdoses in the ER, sure. But I've never seen someone be truly helped in the ER in the way that they are in these sites. I've never seen anyone in the ER be provided with the care, the resources, and the time necessary for them to actually change their lives for the better. In the SCS, we have people come in and thank us, or call us and thank us and say, hey, thanks, guys. Thanks to you guys. I'm no longer living on the streets. I got a job. I'm alive. What I'm asking for is not a strongly worded letter to the province. What I'm asking for is our city councils to engage in legal action to protect the healthcare for our constituents, for your constituents. What we're asking for is for you to instruct the board chair and the MOH to engage the city solicitor about legal responses to challenge the relevant parts of Bill 223 and report back to the board by December 18th. We ask that the board instruct their chair to put a motion before city council at the next council meeting to legally challenge the Community Care and Recovery Act, which encroaches on the jurisdiction of this city to protect the health and the safety of its residents. The people that come into our site are people. We know them. We're on a first-name basis with them. We laugh and cry with them. We love them. They are people often in dire straits, and these are the only places, often, that care for them. I don't want those people to die. I'm asking for your help with that. We will continue to do the work to keep them alive because there are people like you and I and your kids and your cousins and your nephews and your nieces. But if these sites close, many of them will die. I'm speaking to you because we need your help. We need you to do what you can to fight the province to help keep these places open and keep these people alive. What you do with this matters. Our jobs in these sites involve dealing with life and death decisions. Your job in this moment, I think, is making a life or death decision. And I hope you do what is right. Thank you.
I'm on mute. Sorry. Thank you, Deputy Mayor Morley. Thank you, Toby. Can the members turn the cameras on for quorum purposes? And next up is Monica.
Hello?
Yes, you have 5 minutes. Go ahead.
Okay, perfect. Sorry, just give me a second. Oh, okay, my video is off. But that's fine. My name is Monica, and I am a proud member of the Harm Reduction Advocacy Collective, and I also work at a supervised consumption site that is slating to close come March 31st, 2025. I come to speak not only as a member of the community or the city, but also as someone who has personally been impacted by the toxic drug supply on many different levels. As someone who has worked in a supervised consumption site over the last 3.5 years and worked in social services in Toronto for about 5, I've witnessed the toxic drug supply changing in the worst possible ways. And with the ascending of Bill 223, I fear so many lives will be lost because that drug supply isn't going to go away anytime soon. Over the years, I've not only lost friends to the supply, but also clients who every day I have the privilege to spend time with. I listen to this community speak about their goals, past hobbies, family, their frustrations, their fears, their favorite books and movies. With some, I've had the opportunity to listen to music they've created or see the art that they've painted. And this list is short. There's so many things that I can explain that they do on a regular basis that amazes me every single day. Every day I'm referring these same people out to services so they can get support around housing, shelter, detox food, medical care, and other basic needs, yet I see them constantly get turned away. My primary roles in the work that I do is to provide support in reversing overdoses, both inside and outside of the facility that I work at, and refer clients to additional supports when they are ready and ask for them. With the work I do, one of the most traumatic parts is having to witness people get turned away from basic supports, such as having a place to sleep. Housed or unhoused, working class or not working, the impact of Bill 223 will be felt throughout the city. With that being said, I urge that the city follows the facts and data that has been provided by the Auditor's General Report when it comes to the need of supervised consumption sites. And all these sites, as well as harm reduction approaches, to be part of the Heart Hub model. Supervised consumption sites already have a strong rapport with the community of the city. The city says that they want to help and support. So why not let the sites continue running as the city begins to build facilities for housing and detox treatments like they are offering? We talk a lot about having a safer city, but does that mean closing accessible resources to people who need it the most? Does that mean risking children possibly seeing a dead body outside when they're walking to school, or a parent having to explain that conversation to them and why it's happening? I really ask us to sit down for a moment and just question how Bill 223 will really benefit the society by closing down so many essential services. Thank you.
Thank you for your deputation. Any questions? Seeing none. Lamo Dalkar, President, Registered Nurses Association of Ontario. Are you here? Lamo Dalkar.
Can you hear me?
Yes, we can. 5 minutes. Go ahead.
Thank you. Good morning. My name is Lamo Tolkar. I'm a nurse practitioner and the president of the Registered Nurses Association of Ontario. RNU represents over 54,000 registered nurses, nurse practitioners, and nursing students, thousands of them who live and work in Toronto. Like my previous speakers, we are repeating the same thing again, but yes, it is important to repeat to ensure that we advocate for measures that are evidence-based and essential for equitable health access. RNU has been a leader in best practice guideline development and implementation and have over 1,500 best practice spotlight organizations around the world. Amongst them is Toronto Public Health, who we value greatly our relationship. Our evidence-based guideline includes implementing supervised injection services. We thank the chair for convening this special meeting about Bill 223. This bill will kill many lives and it will not spare who it affects. The 5 Toronto sites scheduled to close just 3.5 months from now overturned nearly 5,000 toxic drug overdoses over a 4-year period from 2020 to 2024. The works alone overturned over half of those. Those were the lives that were saved. And we know that supervised consumption sites do much more than this. They are doorways to many forms of care, primary care, mental health services, housing, and they respond to many needs, material and social. Our concerns are not only limited to the immediate closure of SCS, but that the Act will pave the way for elimination of all harm reduction programs dependent on exemptions under the CDSA, including safer supply programs and remaining SCSs. All exemptions are time limited. Under the Act, municipalities and public health units are barred from applying to extend those exemptions. Harm reduction is not the only response to this public health crisis, but it is a necessary one. The pathway to recovery is rarely ever a straight one. People with substance use disorders will most often need to circle back 5 times on an average and rely on harm reduction services to keep them alive until they can try again. Moreover, those who target recovery often don't have treatment services they can afford or access. Addiction treatment services in Ontario are largely for profit and unregulated. There were only 257 publicly funded drug treatment beds in Toronto in 2023. There were 3 times as many suspect drug-related deaths in Toronto in the same year. Supported by $1.9 billion in matching federal funding for their Road to Wellness strategy, the provincial government has done actually nothing to address this public health crisis. Indeed, as the Auditor General reported in the report last week, the Government Center of Excellence for Mental Health and Addiction does not even have reliable data on the availability and quality of existing services, making it difficult to accurately plan or provide for people with opioid addiction. Since coming to power in 2018, over 22,000 people have died from drug toxicity in this province. And before the Auditor General's report could hit the ground, they rammed a bill through the legislature that paves the way for elimination of harm reduction services and precludes you from doing anything about it. In conclusion, we ask that you instruct the board chair and the MOH to engage the city solicitor about legal responses to challenge the relevant parts of Bill 223 and report back to the board by December 18. Instruct the MOH to immediately advise City Council, including the Mayor, about the health implications of the bill for Torontonians and Toronto Public Health. And lastly, instruct their chair to put a motion before City Council at the next council meeting to legally challenge the Community Care and Recovery Act, which encroaches on the jurisdiction of the city to protect the health and safety of its residents. Thank you for your time and the opportunity to represent the thousands of nurses who work and for the lives that are lost. Thank you so much.
Thank you so much for attending today. Any questions for the deputant? Seeing none. Thank you. Karen McDonald, are you here? Karen McDonald? Karen, you have 5 minutes.
Oh no, sorry. I hope, okay, great, you can all see. So good afternoon and thank you for the opportunity to speak today. My name is Karen McDonald. For the last 7 years, I have had the privilege of leading the design and implementation of Toronto's drug checking service with our city's supervised consumption sites and people who use drugs, as well as the clinical laboratories at St. Michael's Hospital and the Centre for Addiction and Mental Health. Our program has checked over 16,000 drug samples using gold standard technologies for chemical analysis and publicly disseminated hundreds of drug market monitoring and drug education reports. Our program has received international recognition and is regarded as a primary source of timely and accessible information on the unregulated drug supply in Canada. I have some exciting news to share today, which is that as of last week, our incredibly innovative and valuable public health program has gone provincial, with services launching in both Kingston and Peterborough. That said, this is really no time to celebrate when Bill 223 is actively dismantling everything we have built. While there is no explicit mention of drug checking in the bill, the collection site members of our program are supervised consumption sites. This means that Bill 223 has serious implications for drug checking service delivery and unregulated drug market monitoring in Ontario and Canada. First, closing supervised consumption sites will impact access to drug checking services. Each of the 10 supervised consumption sites that are closing offer drug checking. 5 of those sites are collection site members of our program, with 4 of those 5 sites being located right here in Toronto. While it is possible for those 10 sites to continue to offer drug checking without their supervised consumption service, there are significant barriers. For example, they would all need to reapply for a different type of exemption and also come up with resources to fund staff to conduct drug checking activities, which has to date been covered using their existing consumption and treatment or supervised consumption service budgets. Second, closing supervised consumption sites will impact access to a continuum of care. While it is not mandatory to offer drug checking in combination with supervised consumption, it is absolutely best practice. I say this because during our pilot period, 21% of service users surveyed by our program, reported intending to use at a supervised consumption site after receiving their drug checking results. Lastly, closing supervised consumption sites will impact our ability to monitor and share real-time information on the composition of the unregulated drug supply. As I mentioned, our program has become a primary source of timely and accessible information on the composition of the unregulated drug supply for the country. About 80% of the samples contributing to our unregulated drug market monitoring efforts to date were collected by these supervised consumption sites in Toronto that are closing. So just in closing, I firmly stand by all of the recommendations that have been made by my peers here today. And I urge the City of Toronto to fight against Bill 223 and really push the envelope when it comes to advocating for our community of people who use drugs and these essential public health services that are being shuttered. Thank you.
Thank you for coming in today. Seeing no questions. Beta Sinajani, We also need one more member to turn their cameras on for quorum purposes, according to the clerk. Thank you for reminding me. Go ahead, Bita, you have 5 minutes.
Thank you. Good afternoon. My name is Bita Senajani. I'm a resident of Toronto, and I'm the Community Policy and Network Coordinator at the Canadian Drug Policy Coalition. We're a national nonpartisan organization working to advance drug policy grounded in public health and human rights principles. It is unusual that our organization, with its national scope, would participate in a municipal process. However, given the unprecedented nature of the act and the life-threatening harms that Toronto and Ontario residents will be facing as a result, we felt it necessary to make this deputation to urge leadership on this critical issue. Toronto faces the largest number of site closures with the new
My
restrictions.
apologies. This is the clerk. Can I just have a request a member to turn their camera on just so we counted for quorum?
Would it be possible to pause the time? Or should I keep going?
No, actually, please pause. Yeah.
It is paused. Can members turn on the cameras, please, for quorum purposes? Otherwise, we cannot continue. How many do we need? There we go. Do we have quorum now? We do. Okay, thank you. Continue. Go ahead.
Great. As mentioned, Toronto has the largest number of site closures and the highest number of toxic unregulated drug overdose deaths in the province. CDPC coordinates a provincial network of organizations who are deeply concerned with the rollback of harm reduction. We, along with numerous experts and researchers, anticipate toxic unregulated drug deaths will soar, and the harms will be borne by those most marginalized in our communities. Research shows that in 2021, unhoused people accounted for 1 in 6 toxic unregulated deaths in Ontario. The implications of this act in an already dire situation are stark. We urge you to explore every avenue to implement life-saving, evidence-based policy. Supervised consumption sites are a common sense, well-researched measure that reduce deaths and significantly improve health and social outcomes. We are talking about 4 decades of well-established evidence that support the implementation and expansion of these services, a sentiment echoed in the findings of our 3-year national community engagement project called Getting to Tomorrow, 7 Actions to End the Unregulated Drug Crisis. Also echoed in Dr. Kieran Moore's annual report, the federal 2024 to 2030 STBBI Action Plan, and countless other expert guidelines. The evidence and the Supreme Court are clear.
You said the motion. Sorry, apologies.
Okay. The evidence and the Supreme Court are clear. Without the ability to access an exemption from the application of the Controlled Drugs and Substances Act under Section 56 of the Act, people will be deprived access to life-saving medical care, and their lives and safety will be unjustly put in danger, as noted in the landmark case for Insight, the first legally sanctioned site in the country. The ability to access an exemption under Section 56 from the application of the CDSA is the safety valve that protects people's lives and safety. It is one of the key ways the CDSA furthers its stated intent to protect public health. Provisions of the Community Care and Recovery Act take away that safety valve and the ability for public health experts and healthcare providers to act in accordance with the evidence and their ethical obligations. To quote from the Supreme Court, if the CDSA consisted solely of blanket prohibitions with no provision for exemptions for necessary medical or scientific use of drugs, the assertions that it is arbitrary, overbroad, and disproportionate in its effects might gain some traction. However, the Act contains not only a prohibition on possession of illegal drugs, but a provision, Section 56, that empowers the minister to grant exceptions from the prohibition to health service providers like Insight. Our network members are deeply concerned with the tragic implications of this act, and we urge immediate action. We are asking you to explore every avenue available to you to ensure that you have and that you continue to use that life-saving safety valve. We have 3 asks. We urge the Board of Health to 1, instruct the medical officer of health to immediately advise City Council, including the mayor, about the health implications of the bill for Toronto and Toronto Public Health. 2, instruct the board chair and the medical officer of health to explore all options to immediately address the health, safety, and human rights implications of relevant parts of Bill 223 and report back to the board by December 18th. 3, we ask that the board instruct their chair to put a motion before City Council at the next council meeting to adopt an immediate action plan to address the act, which encroaches on the jurisdiction of the city to protect the health and safety of its residents. Thank you so much.
Thank you. Peter Bachman?
Mr. Chair, sorry to interject. I wonder if it's the will of the body to extend to complete the agenda. Just noting we're coming up on the lunch break in about 15 minutes, and I think we'll have a few more speakers to get through.
Yes, the clerk is actually working on that right now, and it's our intention to extend the meeting to completion at 12:30. That being said, though, we've been having quorum issues, as you probably could hear, and so I'm not even quite sure if we'll make it through this end of this agenda, just so you know.
Yeah.
This is supposed to be a special meeting of the board, and it's extended way beyond. But we'll do our best on this end. Thank you. Do we have quorum now? Is the cameras turned on?
Yes, we do have quorum now.
Okay. Peter Bachman, are you here?
I am. Good
In 5
morning,
minutes, go
everyone.
ahead.
Sorry, afternoon. Thank you for letting me speak here. Apologies, 1 second. My name is Peter Bachman. I'm a settler who was born in the city. I've cradled a stranger's head in my arms using a device to keep oxygen flowing into their bloodstream to ensure they survive an overdose more times than I can ever imagine counting. No other aspect of my employment is important beyond this, and my thoughts are my own. I'm choosing to leave out personal stories of grief because frankly I'm tired of publicly exhuming 2 long-term partners, 7 community leaders, and countless friends. Today, many of my friends, allies, and colleagues will show you evidence which would suggest with astonishing probability that these sites should continue to operate, and that their functionality is indisputably life-saving, something I obviously agree with full-heartedly. But let's face it, it's 2024. Facts and evidence are dismissed with alarming regularity. Legislators across the board have proven that decisions impacting lives are often made on myths, misinformation, political expediency, and nonsense. I'm here to ask the council to remember why you hold these seats of power and privilege in the first place. Bill 223 and its ascension represent one of those career-defining scales. These were one of the instances which will ultimately define your career as leaders who once chose to elevate the lives of the people within your constituencies. The lives you've sworn to uphold and fairly protect, even if this creates some temporary kickback or negative criticism. History will show us eventually who made the difference. And it should be noted, if the Premier has taught us anything about history within the last 6 years in office, it's that people in Ontario have a penchant for forgiveness. The Council is capable of making the right choices when it comes to policy regarding these essential services. And if you don't care to listen to evidence, listen to the young person within you who aspired to work towards these positions of immense power and privilege you now hold. Reach out to that person and make the change which is right, not just for the political gain or career advancement. Many of us working in these sites no longer even have this option as of April 1st. Not that employment is the focal point here, but for many people, these decisions mean that a digression to a job market that doesn't offer equitable employment opportunities or an understanding of the nuances which people with lived experience face. These setbacks will not only fail our communities, they will kill your constituents and bring forth devastating levels of strain on healthcare infrastructure and eliminate people's incomes. These setbacks will fail the children which are politically weaponized Ironically, a lack of truth, and this I've seen in many forums personally, has caused youth to become the victims when it comes to drugs and their effects. Sheltering children from the effects of drug use can carry disastrous consequences. As a former youth of the inner city and an adult who's had his life ravaged by the effects of the drug poisoning crisis, I can personally attest to the importance of educating young people, empowering them with a compassion and empathy and accurate information to make the right decisions regarding their own autonomy in these environments, instead of just discarding these realities as fear-mongering mythos, only to find that their curiosity leads them to a fate that 2.5 people an hour in Ontario face. That statistic, every 2.5 hours, represents people. People are all children to somebody. Following truth and upholding justice is never an easy battle. It's made with sacrifice, and I've seen many people in this industry lost to the opposition we face. The only difference is that this battle doesn't answer to a governing body, only the thresholds of a human body. Many of my friends have died to keep each other alive. A man who did just that once said, and I will close with this, someday soon an enlightened society will look at these names as victims of war crime. This enlightened society will regard the politicians, the judges, the police, the doctors, and the reporters who perpetuated this war as war criminals. Court workers, social workers, psychiatrists, landlords, so-called addiction workers. In short, all the people who knowingly watched these crimes and did nothing to stop them. They will all bear the stains of this horrendous war crime called the war on drugs. I hope you'll use your power not to uphold the failures of the past, but to build a future where all people, not just the privileged, are given the chance to live in dignity, safety, and hope. Thank you for your time.
Thank you, Peter. Any questions for Peter? I see none. Thank you again. Joseph Asenzo. Joseph Asenzo. You have 5 minutes.
Thank you. I'm coming to you as a person with lived experience injecting drugs for over 30 years. Drug treatment centers many times. It never works for many reasons. In 2018, I was living rough and got connected to South Riverdale Community Health Center for Hep C treatment. The reason why I finally got the treatment was because the way I was treated. It was with dignity and respect. I tried many times throughout the 15 years to receive treatment. I was always being judged or stigmatized from the other places. And while on treatment, I did their peer training. I graduated. I was on ODSP at the time, then got a job as a community support worker. I have not been on ODSP for the last 3 years. I have been a community health worker working full-time ever since with the Toronto Community Hep C program. I have also worked in a safe injection site during COVID. I have seen how they've been able to support people without judgment and connect them to what they need at the moment. I have lost family and friends to the toxic drug supply. The safe injection sites give people connections with what they are looking for at the time. They give people using them a place to connect to a community. The safe injection sites are heart hubs. You cannot force people into treatment. They have to be willing and ready. And from what I've seen and know, even the ones that are ready have an extremely difficult and challenging time getting into drug treatment programs or alcohol treatment. I know because I've been there many times. I must mention that they're always being judged and stigmatized at drug treatment centers. Treatment only works when you're forced. You can never understand until you walk a mile in someone else's shoes. Harm reduction works. I asked the board chair and medical officer of health to engage the city solicitor about the legal responses to challenge Bill 223 and report back by December 18th. People are going to die without these sites. I instruct the medical officer of health to immediately advise the city council and mayor about the health implications of this bill for Toronto and Toronto public health. The facts and data are there, and policies should be informed by it, and that the board instruct their chair put a motion before city council at the next council meeting to legally challenge the bills. Thank you.
Thank you very much, Joseph. Seeing no question from members, we'll move on to Morgan Garnett. Morgan Garnett, you have 5 minutes. Good morning. Go ahead.
Thank you. Hello, everyone. My name is Morgan, and I'm a member of the Harm Reduction Advocacy Collective. At this moment, I do respectfully request counselors to turn their cameras on to give this issue and those deputing the presence and attention they deserve. I've been involved in the drug user liberation movement and anti-homelessness activism for at least 15 years. For 10 years, I've done paid work as a community worker with a focus on harm reduction, including at a safe use site. I now do grief and loss work in the context of the drug poisoning crisis. In this political climate, I tragically have no doubt that I will have stable and unrelenting support work to do for years to come as the toxic supply continues to kill more loved ones every day. This will also include navigating the grief felt by the loss of these sites, which are support conversations I'm already having. To my point, just last Thursday, a suspected overdose claimed the life of a friend's loved one, which follows just 3 weeks after the suspected overdose death of my aunt's ex-husband. Both of these people lived in Ontario, one of them in Toronto. When I first started doing formal work, the deaths were at the deaths that were at a closer proximity to me were more spread out. It happened about a year, maybe 6 months apart. In the last years, significantly since COVID, I've had these deaths inch closer and closer together. I suspect I won't be able to make another full month before the next person dies, and that's with the existing services. To this end, I come to you with a grief-swollen heart and an absolute terror of what comes next after the Bill 223 is enacted. I know that with no safe place to use, many of our loved ones and community will die in parks, public bathrooms, and alleys. Those who do have a place to use will not have access to vital services to discuss safer ways of using, including strategizing on the ever-changing toxic drug supply. The drugs that we started this crisis with are not the drugs that we're battling today, and it's important to have this information out in community. I stand, or I guess sit, here to remind you of your power to make changes and your civic responsibility to protect all of your citizens. All of your citizens. These reminders, at the core of my message, I have the following demands. To instruct the board chair and the medical officer of health to engage the city solicitor about the legal responsibilities to challenge the relevant parts of Bill 223 and report back to the board by December 18th. We need more than a strongly worded letter. Do not let these requests and passing words today collect dust while people die. I ask that you instruct the medical officer of health to immediately advise City Council, including the mayor, about the health implications of the bill for Toronto and Toronto Public Health. The data is there, and policy should not be informed and should be informed by it, not morality. I ask that the board instruct the chair to put a motion before the city councilor to the next city council meeting to legally challenge the Community Care and Recovery Act, which encroaches on the jurisdiction to the city council and protect the house of all of its residents, not just the ones with whom they feel affinity. I implore you to take action in an active stance in the opposition and overturning of this malicious bill, and remind you that talk is cheap and costs our loved ones' lives. I end this by emphasizing that all of the people who use drugs' lives matter, especially those who are marginalized and most vulnerable. I must mention those who are racialized and Black and Indigenous people. We are part of the community, and we are not considerable nor acceptable losses. Thank you for your attention.
Thank you, Morgan. Any questions for the deputant? Seeing none, thanks for coming in today. Sandra Kehan Chu. Sandra Kehan Chu.
Do we want to extend?
Yes, let's do that now. The clerk has a motion to extend to complete the agenda. Councillor Perks moves it. All those, do you need to post it?
It's okay.
Okay, all those in favor? Opposed, carried. Thank you. Sandra Kehan Chu, are you here?
I believe she has dropped on, but I think her partner is still here, so I can promote them to the next speaker.
Okay. Is the next speaker Cecile Kazachinski? Kazachinski? Cecile? Help me pronounce your last name before you begin.
Kazachkin, Cecile Kazachkin.
Okay, thank you. Go ahead, you have 5 minutes.
Thank you. Thank you so much for the opportunity to speak today. I speak on behalf of the HIV Legal Network, an HIV and human rights organization. For years, we've been advocating for the removal of legal and policy barriers to life-saving, evidence-based supervised consumption services, and we produce reports outlining the evolution of these services in Canada. We know we need more SES, including inhalation SES, and we need more funding for these services. But the Ontario government decided instead to erect new barriers that will prevent SES from operating and expanding, including in Toronto. The Community Care and Recovery Act will have colossal ramifications for Toronto's ability to respond to the toxic drug crisis, and it must be challenged. First, no one, whether it's a municipality or community organization, will be authorized to operate supervised consumption services within 200 meters of a designated premises. In Toronto alone, this will affect at least 5 SES, including the works run by Toronto Public Health, as well as municipally-supported UPH&S temporary services, often embedded in shelter services. No alternative will be provided to clients that rely on these services to survive and to get support. And SES providers will be left without space and structure to respond to overdose-related emergencies. The 200-meter rule was unilaterally decided by the province without consulting with the population that will be disproportionately impacted by it, or I believe by municipalities that will have to bear the devastating consequences of these prohibitions. The legislative process was rushed and fundamental steps such as community review were bypassed. The Act will also prevent municipal authorities, including local board of health, from operating new SES or renewing their exemption, including for UPH&S, unless they receive provincial approval. It will also bar municipalities from supporting other SES applying or renewing their federal exemption, likely through funding, unless, again, they receive provincial approval. And the Ministry of Health made it clear there will be no further approvals of consumption sites in the province of Ontario under their government. The Act will result in preventable deaths and impose extreme pressures on emergency services, and it will also increase public drug use. At a time where Toronto faces a relentless drug toxicity epidemic that has already taken the lives of so many Torontonians, these unjustified constraints on the establishment of life-saving SES cannot be unchallenged. Additionally, the Act will prohibit any local initiative to decriminalize personal drug possession in Ontario, an initiative that Toronto itself took in 2022 by seeking a federal exemption under the CDSA. And given that the criminal law is within the exclusive jurisdiction of the federal government, it remains unclear whether the province has the legal authority to do this. The Act will also prevent the city or local board from seeking federal funding for safe supply program without the approval of the ministry. Again, the legal authority for the provincial government to intervene in the health funding decisions of municipalities is unclear and could set a worrisome precedent if it remains unchallenged. As you've already heard, the Ontario government decided to introduce this act knowing from their own experts that there is a high risk it will increase emergency departments overdose deaths and other negative health impacts, as well as public use, and disproportionately harm Indigenous, Black, and low-income people in Ontario. You've also already heard that in 2011, the Supreme Court of Canada unanimously ordered the Federal Ministry of Health at the time to grant Insight, the first legally sanctioned SES in Canada, an exemption to continue operating. The court found that Insight saves life and ruled that denying an exemption would violate the charters. People who use drugs, frontline staff of harm reduction and health agencies, public health scholars, and human rights advocates have universally denounced this legislation. Today, we collectively ask the city to step in and refuse unjustifiable and deadly constraints on its power to provide support to Toronto residents. Like others, we urge the Board of Health to instruct the board chair and the medical officer of health to engage the city solicitor about legal response to challenge the Community Care and Recovery Act and report back to the board by December 18th. To instruct the medical officer of health to immediately advise City Council, including the mayor, about the health implication of the bill for Toronto and Toronto Public Health, and to instruct the board chair to put a motion before City Council at the next council meeting to legally challenge the Community Care and Recovery Act, which encroaches on the jurisdiction of the city to protect the health and safety of its residents. Thank you.
Thank you. Any questions for the applicant? Seeing none, thanks for coming in today. Mon Martins, you here? Mon Martins? Okay, you have 5 minutes.
I'm here.
Okay, go ahead, 5 minutes.
Thank you. Good afternoon. Thanks to everyone here and for all of my brave colleagues who've spoken before me. My name is Mon Martins. I've been a frontline harm reduction worker at a CHC for about 7 years now, a settler on unceded land, and a person who cares deeply about the health and wellness of people who use drugs. The last time I deputed at the Board of Health, it was in 2018, and I am disheartened to be here today to acknowledge that we've regressed this far in 2024. Where I live, I can see Parkdale Queen West safe consumption site from my front porch. I welcome this service that is literally in my front yard. I'm here today urging you to advocate for all Ontarians to take action, to hear our requests to legally challenge the Community Care and Recovery Act, to explicitly withdraw your support from Bill 223. When these sites close, drug use does not disappear. Drug use just becomes more covert and people die. Health Minister Sylvia Jones shared concerns about discarded needles and the impact that witnessing drug use will have on children, but her solution is to prohibit the very sites where public drug use occurs in a private and controlled environment, where staff do community cleanup to dispose of discarded drug use equipment. Today, I'm wondering about the impact on children who will lose a parent to overdose when these services are no longer available. Like my friend Dylan, who found his dad, Leon, dead from unregulated fentanyl. I'm wondering why the government is prioritizing the fear and the discomfort of some over the lives of others. The provincial government wants the public to believe that supervised consumption sites enable drug use and prevent service users from accessing treatment. This is a false premise and a distraction from the issue at hand. Harm reduction and drug treatment are not in opposition. I'm not sure if anyone on the Board of Health here has been to a safe consumption site, but when people show up and they request treatment, staff don't just shrug and hand them a syringe. The fundamental issue here is that there is a lack of accessible and affordable treatment options. And in the interim, we need to keep people alive. And this is in Toronto. This is not even considering northern communities, Indigenous communities who will be hit much harder than we are in the city. For the last week, I have been entirely occupied about this incredibly short-sighted bill. I'm distraught thinking about the number of people I know who will die without these sites. I want folks to imagine, Councillor Bravo, Perks, Chris, imagine someone that you love and imagine that the government passes a policy that will basically guarantee the people that you love will die. These are unique and complicated, wonderful people who make up this province, and in a number of months, they will die. This is the reality for many of us now. Please listen to us today, those of us with lived experience, who've worked frontline, to evidence instead of supporting this overcomplicated duplication of a service that is already happening in harm reduction rooms and safe consumption sites across the province. Quite frankly, I don't want to depute here ever again. Please don't let our voices just wash over you today. We can't afford to keep wasting time fighting about the same issues. I know you on the Board of Health care about the people in the city, the health of the people in this city and in this province. I'm asking you today if you personally are willing to pick up discarded needles and pipes where they lay abandoned once EMS removes a body. Are you ready to reverse an overdose in a Tim Hortons bathroom or in a bus shelter when we no longer have these sites? Please don't let our progress over the last several years be in vain. Thank you.
Thank you, Mon. Any questions for Mon? Seeing none. Thank you for coming in today. Trevor Haida. Are you here? Trevor, you have 5 minutes. Go ahead. You're on mute, Trevor. There we go.
Hi, can you hear me?
Yes, we can.
Thank you. Good afternoon. Thanks to the board for allowing me to speak today. Before I begin, I want to acknowledge the toxic drug crisis in Toronto. This morning, I'll be speaking of loss and vulnerability related to the crisis, and I do so with heavy heart and with great respect for those who have been most affected. My name is Trevor Haida, and I'm a social worker and currently the overdose prevention site coordinator at Street Health. Our site is located at Dundas and Sherbourne in Toronto's downtown east, just a few minutes walk from Yonge and Dundas in the core of downtown. As a site, we feel very lucky to be excluded from the list of upcoming closures. But our site is small and runs without any government funding. The Safer Streets, Stronger Communities Act will have dire effects on our program and on our community. The Center on Drug Policy Evaluation recently reported significant empirical support for supervised consumption sites in Ontario. Their findings noted that these sites reduce overdose-related harm and mortality, reduce unsafe injection practices, reduce risk of disease transmission due to injection, and reduce the burden of emergency departments. Importantly, the study tells us that these benefits come at no cost of community safety. There are no attestable increases in homicide rates surrounding consumption sites, nor are there increases in assaults, robberies, or B&Es. Many of these neighborhoods have experienced declines or lesser increases when compared to communities without a site. The depiction of these sites as increasingly dangerous and risky by our provincial government when looking to the data is overwhelmingly incorrect. Now, I want to tell you a little bit more about the site I work in because Street Health's overdose prevention site is unlike those you may think of. We're donor funded and fairly low capacity. While larger sites might see upwards of 60 or 70 visits in a day, we typically see about 10. We offer a unique service in the landscape of harm reduction by tailoring our site to those most likely to be overlooked. By removing barriers like time restraints and maintaining a less clinical environment, our site is often able to create space for folks who have lost access to other sites or don't feel safe accessing them. More than half of our clientele are women, which is a significant overrepresentation compared to broader supervised consumption usage. We also see overrepresented numbers of clientele who are Indigenous, people living with disabilities, and people who are over 65. We're very proud to offer services in this way to these people, but unfortunately, it all seems like it may be forced to change very soon. As we consider the sites slated for closure in March, many of which are in our downtown community, we expect a significant increase in volume. We can't know exactly what will come, but if even a small percentage of those folks accessing the Works, Regent Park, and Moss Park CTSs choose to access ours post-March, we will be stretched far beyond our capacity. Having to pivot to stricter, more rigid systems will undoubtedly abandon those folks we have historically aimed to serve. Everyone deserves access to harm reduction, and as a result of this act, some of the city's most overlooked individuals will lose it. At this time, I want to echo previous deputants in urging the Board of Health and the City Council to leverage your influence. Support local efforts challenging Bill 223. Instruct the Board Chair and the Ministry of Health to engage the City Solicitor about legal responses to challenge relevant parts of Bill 223 and report back to the Board by December 18th. Instruct the Ministry of Health to immediately advise City Council, including the Mayor, and about the health implications of the bill for Toronto and Toronto Public Health. Finally, I ask that the board instruct their chair to put a motion before City Council at the next council meeting to legally challenge the Community Care and Recovery Act, which encroaches on the jurisdiction of the city to protect the health and the safety of its residents. Sites in the downtown east and across the city are already taxed with the severity of the crisis we are facing. Workers and clients at Street Health running an unfunded site cannot pick up the slack if we lose half of our city's supervised consumption capacity. We are deeply afraid of the incoming pressure on emergency services and communities and the inevitable loss of life that will take place as a result of Bill 223. Thank you for your time.
Thank you. Any questions for Trevor? Seeing none. Thank you for coming in. Stephanie Neisner. Stephanie Neisner. Are you here? Here you go.
Can
Here
you
you
hear
go.
me?
Yes, we can. 5 minutes. Go ahead.
Am I on video?
You're not, but we could hear you.
Can
Yes,
you
you're
see
on
me?
video. Yes, I can see you now. Go ahead.
Okay, so first of all, I'd like to thank all the attendees and thank you for welcoming public opinions to this meeting. My name is Stephanie Neisner. I'm a local mental health case manager. I've completed my education at the University of Waterloo and Humber College. I've been working to provide public services to vulnerable populations in Toronto for the past 5 years. I work with those who are struggling with their mental health to reach the goals they've set for themselves. Many of these goals revolve around changes in substance use. I'm speaking to warn the Board of Health of the consequences of the imminent closures of the supervised consumption sites. Since approximately 2015, we have seen a sharp increase in fentanyl-related deaths. In Canada, we see an average of 21 deaths per day and 17 hospitalizations. These are not just numbers, and the lives lost are valuable people. They have left behind mourning families and friends, lost souls, and lost potential. Those speaking today see these deaths and suffering up close and know people who have passed away, people who are working on themselves and caring for those around them. It absolutely breaks my heart to see someone working so hard just to survive and be pushed down by so many barriers of high grocery prices, soaring rents, and long wait lists for addiction and mental health supports. If you have not yet been personally touched by the toxic drug supply crisis, it's only a matter of time. Every single person is closer to the grief and loss of toxic supply than they realize. So ignore this is to live in denial. Our supervised consumption sites and harm reduction measures have been a source of glowing hope for those at risk. They not only offer a safer space to use, but link to valuable supports, nurses, case managers, counselors, housing workers, and ID clinics. These spaces began out of need, and especially since the COVID-19 pandemic, that need is only growing. Bill 223 ignores our growing need and buries the fruits of our labor. With the changes outlined in this bill, we will see our currently overwhelmed emergency response measures acting as ineffective overdose prevention. Our emergency rooms will be filled with our dead and dying. Those struggling and unhoused will be pushed into using substances in public spaces, back alleys, parks, and bathrooms. Those who are housed will be using alone, with no one to check if they still breathe, no one to administer life-saving oxygen and opioid antagonists. These people will die alone in their homes. But this reality is not necessary. Our community came together to create safer use spaces, and now we come together to try to keep them. Opioid overdose deaths are preventable deaths if you are willing to prevent them. Our community came in full force today to show that we do want to prevent them, and we implore you, our community leaders, to keep our supervised consumption sites open so that we can continue to prevent overdose deaths. We ask that you engage our city solicitor regarding legal challenges, reporting back to the board on December 18th. We ask that the Minister of Health advise our City Council about the violent health implications of Bill 223 for Toronto public health. And we ask that you put forth a motion to the City Council to legally challenge Bill 223 on the grounds that we, as Torontonians, have the legal right and responsibility to invest in the health and safety of our city residents.
Thank you. Any questions for the deputant? Seeing none, thank you for coming in today. Justin Niera, Ariza, are you here? Justin? Okay, you have 5 minutes. You can go ahead, Justin.
Thank you to the Board of Health for allowing me to speak today. My name is I'm here.
We could hear you. Go ahead and speak.
Thank you to the Board of Health for allowing me to speak today.
Speak directly into your mic. You're very muted.
To the Board of Health for allowing me to speak today. My name is Justine Neda Isa. I'm a harm reduction social worker, community member, and constituent of the city in Ward 9. I'm here to speak on the recommendation by Councillor Moyes that the Board of Health direct the medical officer of health in consultation with the city solicitor to submit comments on Bill 223 before December 18th, 2024. To that I said, forget the idea of comments. We need action now. The trespassing of Bill 223 was a devastating, gut-wrenching notion that we should all be ashamed of. we have been living in crisis, many caused by the decision of the current provincial government. There is nothing about safety in the Safer Streets and Stronger Communities Act that will protect us. Close to safe consumption sites and banning the application pathway to any future sites is a death sentence. In Toronto, safe consumption sites alone prevented nearly 11,000 overdoses just between 2020 and 2024. The scale back of harm reduction services, including distribution of new and sterile kits and needle exchange programs, will result in the increase of chronic and bloodborne infections for an already vulnerable community. Closing the door to safer supply programs mean that many will not have access to evidence-based treatment in a nationwide toxic drug supply crisis. Outreach workers, drop-ins, community health centers, service providers across the center of mental health and substance use are undersourced, underfunded. We need funding that acknowledges and supports the evidence gathered for decades about already existing and life-saving healthcare. The ballooning budget of the Toronto Police Services is a continuous slap in the face to many service providers. Presenting TPS as a role of safety, joining outreach teams, and standing by in emergency departments is also a slap in the face. What about any of this seems like safety to you? More importantly, who is in the name of the safety for? We cannot police our way out of this. We are facing health emergencies. We need housing. We need a full spectrum of primary care, including harm reduction, safe consumption sites, safe supply. We need accessible and voluntary treatment. We need increased livable wages. We need drug policy changes. We need community care, not police. We cannot care for people that are dead. Every life that is lost is the life of a son, a daughter, a parent, a friend, and we are all so tired of grieving. Closing sites will not stop public drug use. EMS response times will increase. Hospitals that are already overburdened will flail. Every citizen will be at risk. Tools that safe consumption site workers will have will not be available to us, and the ways that they show up for community will disappear. Many of them will be left with no place to turn. The lives of many that will be in the hands of the citizens, not healthcare providers. Continuing to increase police funding will not keep us safe or alive. Board of Health, you have to acknowledge that many people have entrusted you with their stories, their experiences, their perspectives. There is no more time for comments. We need your leadership as the Board of Health to legally challenge the Community Care and Recovery Act to protect health and the safety of Torontonians. More than ever, we need justice by means of action and compassion, not shame or a scale back in the spectrum of services or support from the municipal government. We ask that you instruct the Ministry of Health to immediately advise City Council, including the Mayor, about the health implications of the bill for Toronto and Toronto Public Health. We ask that the board instruct the chair to put a motion before City Council at the next City Council meeting to legally challenge Community Care Recovery Act, which encroaches on the jurisdiction of the city to protect the health and safety of its own residents.
Yes.
I
Thank you.
will share a note that a client gave to me, a client that was on a long time prescription of safe supply. This note also has a painting of a puzzle. He drew himself picking up the different pieces. Along he wrote, "Thank you for helping me pick up the pieces when I could hardly find a reason to salvage my own broken life. But I am grateful that I had you and the services that I had to walk there beside me. And for that to be okay, maybe not great, but just in case I needed someone not to hate. We will not stop fighting for community-based care. Thank you kindly for your time."
Thank you so much for coming in today. And the last speaker we have here is Emile Frenet. Emily,
Yes, hi.
go ahead, 5 minutes.
Okay. Hi, I want to thank the Board of Health for allowing me to speak today. My name is Emilie Frenet. I'm a nurse practitioner at Street Health. I have 15 years of experience working in harm reduction in both in Montreal and Toronto. I have worked as a nurse in needle exchanges, Hep C outreach teams, mental health and addiction teams. I have worked at the Works' supervised consumption site, and until last summer, I was the NP at Toronto Public Health injectable opioid agonist therapy program. I'm going to repeat some of what the previous speaker have said, but I feel it's important for these to be said and repeated and re-repeated so that they can be heard. Safer consumption sites reverse overdoses daily. They actively save lives and help prevent poorer health outcomes as well. They help monitor a person after an overdose. They help with safety planning, which helps prevent repeated overdoses. Having a safe and clean environment to inject and having access to the appropriate material helps prevent infections, cellulitis, endocarditis, hepatitis C, and so many other complications. And I'm sorry, I'm going to be pragmatic about this and sound maybe callous to some of my coworkers or colleagues, but these things are expensive to our healthcare system. Our healthcare system is already stretched, and these are just going to add to it. Safer consumption sites help limit the number of calls to emergency services as well. Closing these SCS will lead to longer wait times for 911, for emergency services, but also for emergency departments. Not only will closing the SCS increase the overall number of those calls, but also the places where people will be using, such as alleyways, parks, public washrooms, may lead to delays in response to overdoses. So this will not just mean that people will be dying in public spaces, because they will. There's also the risk of having a delayed response to an emergency situation, leading to long-term consequences to the person, such as brain injuries. These things are one more thing that will be an extra load on our system. Yeah. Supervised consumption sites also offer low barrier services. This can help people access services that they would not otherwise access. Many individuals do not trust our healthcare system. Many have faced stigma, discrimination, and judgment. Low barrier services are necessary to help connect these individuals to services. Forcing someone into treatment, as we know, as we've seen in research, puts the person at a higher risk of relapse and overdose when they leave the treatment place. Harm reduction services and supervised consumption sites can help the person's motivation and desire to access detox and rehab when they are ready. We do not need less supervised consumption sites and less harm reduction services. We actually need more. We can help support for more timely access to other low barrier services, such as detox, rehab, housing workers, mental health supports, ID clinics, and primary health care. Supervised injection sites, needle exchange, safer supply, those are all ways to access people where they are, and listen to them and be the person that's there when they say, you know, I don't like this, I want to change. These are the places where we can make the most difference, the most impact. Once again, me talking about money and cost and the stretch of our healthcare system is not to say that these people need less or they're going to be more of a burden. This is to point out in terms that politicians sometimes understand a little bit more, is the cost of it all. It is cheaper in the long run to continue with harm reduction than to move away from it. These people deserve help. They deserve proper health care. They deserve timely health care. So I urge the Board of Health and City Council to leverage your influence, support the local efforts challenging Bill 223, instruct the board chair and the MOH to engage the city solicitor about legal responses to challenge the relevant parts of Bill 223, and report back to the board by December 18. Instruct the Ministry of Health to immediately advise City Council, including the mayor, about the health implication of the bill for Toronto and public health. Finally, I ask the board instruct their chair to put a motion before City Council and the next council meeting to legally challenge the Community Care and Recovery Act, which encroaches on the jurisdiction of the city to protect the health and safety of its residents. Sites in the downtown.
Thank you. Your time.
No problem. Thanks.
My apologies. Thank you so much. Seeing no further questions, we will now take it in-house and ask the members if they have any questions of staff. Councillor Perks, go ahead.
Thank you. My first question is maybe to the medical officer of health. I just want to confirm at the last meeting of the Board of Health, we directed you to begin that conversation with the city solicitor and also to begin a conversation with the heads of Toronto's emergency services to report to our next meeting. Is that correct?
Through the chair, that's correct, Councillor.
So you've already, I assume, begun the conversation with the city solicitor about legal avenues and so on, and you and the city solicitor are currently working that through.
Through the chair, that is absolutely correct.
And some of the deputants raised some particular issues, legally speaking. I imagine that's part of the conversation. Maybe someone from the city solicitor could comment.
Yes, we've got our city solicitor here.
Yeah,
Or
through the
from the legal
chair.
department.
Yes, through the chair, our report for January 20th will address the issues that have been raised.
Okay. And the city solicitor is the lawyer of the Board of Health as well, yes?
That's correct, yes.
And-
I'm the lawyer. Sorry, I'm not the city solicitor. I'm the lawyer for the Board of Health.
But you're employed under the auspices of the city solicitor. So it's effectively the same thing. And potentially, I'm not asking you to forecast, but potentially there could be instructions given by the Board of Health at that time.
There could be, yeah. I think it's too early to tell. We'll have to discuss further at January 20th meeting, but we can talk about that.
And without revealing anything, just generically speaking, as part of that work, I imagine you and others from the city solicitor's office are in conversations with other stakeholders about the legal issues here.
Yes, we've had some interaction with others in the community about potential legal claims or challenges.
Okay, and to the medical officer of health, beyond the work with the city solicitor, a number of deputants raised broader concerns about the strains on our emergency services, paramedics, police, fire, and so on. That's though you're going to be consulting with those emergency services as you develop advice for us for that next meeting.
Through the chair, yes. As you know, Councillor Perks, we've outlined at a high level our concerns, on behalf of some of those services, recognizing, as a provider ourselves, how many overdoses are reversed within the context of consumption and treatment services and SCS. But we're getting further details premised on more specific information, whether it's from fire, paramedics, police, Toronto Community Crisis Support, and as well conversing with our partners in the community and looking at hospital data as well.
Thank you so much, Mr. Chair. Those were my questions.
Thank you. Deputy Mayor Morley, I think you had some questions.
Thank you, Mr. Chair, and thank you to Councillor Perks, who got where I wanted to go as well in terms of the line of questioning. But I think just in terms of timing, of course, these are very, very impactful and sensitive concerns that we're navigating. And I just wanted to understand in terms of the anticipated timing of this bill, the impacts of the closure, and the timing on our end with the report back in January. Can we just speak a little bit about that, and if there's a need for us to think about advancing things maybe a little bit sooner at City Council next week?
So I can start, Dr. Davila, through the chair. The bill has been passed as of last week. It's in force. My understanding is the closures or the impacts, the 200-meter prohibition is not in effect until March or April 1st, 2025. There are other sections of the bill that are in force as of the date of passing. So those include the restrictions on what boards of health and municipalities can do in terms of applying for new exemptions or applying for funding from Health Canada.
That's helpful. Thank you.
Okay, thank you. Seeing no other questions of staff, I'm going to go to speakers. Councillor Perks, go ahead.
Thank you. I want to begin by offering profound and heartfelt thanks to everyone who came out here today. Many of us have been working on this alongside you for years now, and a number of us have also experienced personal loss. And I just want to thank you for your intelligence, your compassion, your thoughtfulness, and also for your anger. What the province is doing here is just reprehensible. And I know that everyone at Toronto Public Health and everyone on the board is just as committed as you are to pushing back on this absolutely heinous decision by the province of Ontario, which is not informed by evidence, which is not informed by wisdom or intelligence or compassion, the way the folks that we listen to here today are informed. We cannot let this stand, and we are doing everything in our power, both directly and through our other relationships, to push back against it, and we will continue to do that work. It struck me listening to the deputations, how on the other hand, the province didn't even have committee hearings on this, and how the Auditor General said the province didn't even consult. It's not much of a stretch to say they just didn't want to hear the truth. They didn't want to hear your truth and the truth of Torontonians that was spoken in this meeting here today. And that's why, I want to acknowledge also Chair Moyes for calling this as a special meeting and for taking leadership to be outspoken on this and convening us together very quickly so that we could have these voices heard as part of the campaign to stop the province for proceeding with this. Let's all keep working. This is something we can and must win.
Thank you, Councillor Perks. Any other speakers on the item? Deputy Mayor Morley, go ahead.
Sorry. Go ahead, Deputy Mayor.
Thank you, Vice Chair Bravo and Mr. Chair. I just wanted to take a moment to echo the comments from my colleague, Councillor Perks, and I just wanted to provide a heartfelt thank you to the advocates and organizers on the ground, particularly those with lived and living experiences, for taking the time to join us here today, for championing this important issue, and for continuing to put care and compassion first in your work. This is important. As Councillor Perks said, we have to win this. We have to take better care of each other. We have a responsibility, a shared responsibility. So thank you so much for taking the time, and we will continue to undertake this important work. And I want to acknowledge, of course, as well, the leadership from our Medical Officer of Health, Dr. Davila, all along. I think has been an incredible champion for this, and sharing the facts, the data as we know and understand it, and ensuring that we as a city are leading with compassion and with intelligence, ensuring that this is a caring community that we can all be proud to be part of, and that work will be ongoing. Thank you so much.
Thank you, Deputy Mayor Morley. Councillor Bravo.
Thank you, Chair. I will echo my colleagues' words, both Deputy Mayor Morley and Councillor Perks, and to say that it is really devastating that people have to come here to speak the truth, that they weren't able to provide these words to the provincial government as it considered how to proceed. Of course, we know that none of these actions have anything to do with protecting lives, with ensuring fair and equitable health outcomes for people, and for meeting people where they are and providing them the services that they need to live and to not just survive, but to live a good life in so many different ways. As provincial government is undermining the essential rights and freedoms that are guaranteed under the Charter for people, whether it's invoking potentially using the notwithstanding clause to deprive people who are unhoused of their constitutional rights. And in this case, the majority of the deputants, or all of them, wanted to make sure that the City of Toronto will join alongside anyone who is challenging the legality and of what the provincial government has done. And I am certainly wanting to provide comfort to all of the people that came to speak to us and all the people that have been reaching out to my office and the conversations that I've had with community members and advocates to say that we are with you, and we have a process and procedures. This is a special meeting that the chair called. I want to thank you, Chair, for doing so, because you've provided, we've provided here a forum to hear the truth and to give us the courage to continue to pursue by every means available what is good public health policy for the people of Toronto. Thank you.
Thank you, Deputy Mayor. Sorry, Councillor Bravo. I want to make a few comments as well, and I want to echo what my colleagues just mentioned as well. Thank you to all the deputants who came in and really just told their truth. And, you know, I was actually just, it was heartfelt, and I felt it here. I saw Deputy Mayor Morley had tears in her eyes at one point. So we hear you. We're not outside of this realm. We're actually in it with you. I live in the city. I live in the downtown core. You know, my background is addictions, so I know this work intimately. I also, when this news first came forth, you know, I went to various safe consumption sites. I spoke to the staff who work there and just told me their testimonials and how this impacts them, you know, their work, and also to the clients themselves, or like family. I spoke to some clients myself, and, you know, they told me how they felt and how they feel unseen and unheard. So I'm on the ground and I hear it. And I know this board have stated very clearly from the outset at every opportunity that we do not support the closures of safe consumption sites. You know, we've passed motions here at the board, we've passed motions at council. The mayor have spoken out against it as well. So we have done everything that we can in the way that we're able to. And we'll continue to stress those points as well. I do have a motion. I did mention that, right? So again, initially was to give direction to the solicitor to make comments to the province opposing the closure of safe consumption sites. And as you know, the province has fast-tracked this, and they stopped any public hearings, and this was officially passed on December 4th. So this is after the fact. This motion is actually for the medical officer of health and the chair to submit the letter nonetheless to the ministry, saying that, you know, we do not support the closures of safe consumption sites, and to also address the Safe Streets Stronger Communities Act. So I do hope that my colleagues here will support this. The fight will continue, even though this has passed. We know what will happen after March 31st. We know that people will die as a result of this, right? And I do hope that the province will have a change of heart at the end of the day, because there's still time to make the right decision. I see there's two hands up, Councillor Perks and then Deputy Mayor Morley. Go ahead.
Yeah, just to prevent any confusion, Mr. Chair, your motion did strike out the bit about the city solicitor, but that's only in terms of writing to the province. We are still going to be getting advice from the city solicitor at our next meeting on the legalities of what the province is doing, correct?
That's absolutely correct.
Okay, just thought folks needed to know that.
Yeah. Deputy Morley, you had a question as well?
Just the exact same thing, Mr. Chair. I think the real call to action we heard loud and clear today was around the city understanding our legal options around challenging this bill. And so I just wanted to be crystal clear as well that that work is undertaken, and it will be coming forward in addition to the motion that you're moving here today. I just wanted to be really crystal clear about that.
Yeah, that's correct. And that will be at the January 20th meeting or 21st meeting, whichever date that is. Okay, wonderful. Seeing no other questions, I'll ask for a vote on this. All those in favor? Opposed? Carried. Thank you. And that brings us to the end of our agenda. I want to thank, again, everyone for attending today and for computing today. It was a good meeting, and you're valued and appreciated. Have a good afternoon. Bye.
Bye, everyone.
Bye.
Mr. Chair. Bye, everyone.